deaths. We now come to the Select Committee statement. Dr. Dan Poulter, representing the Joint Committee on the Draft Mental Health Bill, will speak for up to 10 minutes, during which no interventions may be taken. At the conclusion of his statement, I'll call members to put questions on the subject of the statement and call Dr. Dan Poulter to respond to these in turn. Can I emphasise that questions should be directed to Dr. Poulter and not to the relevant government minister. Intervention should be questions and should be brief. The front bench may also take part in questioning. Dr. Dan Poulter.
Thank you, Mr. Deputy Speaker, and I would first like to draw the House's attention to my declaration of members' interest as a practising NHS psychiatrist. The Joint Committee on the Draft Mental Health Bill was formed on the 4th of July 2022 to scrutinise this important and urgently needed reform of mental health legislation. Our committee has been working hard since that date. We held 21 committee meetings in just over 12 sitting weeks. We spoke with over 50 witnesses, received over 100 submissions of written evidence and engaged with affected communities through surveys, roundtables and a visit to the mental health unit at Lambeth Hospital. We are very grateful to everyone who took the time to contribute to our inquiry, to the officials and ministers of the Department of Health and Social Care for their engagement with our work, and to our specialist advisors and Secretariat. Working on the Joint Committee was a collaborative process as we worked together through this complex topic and learned from each other's expertise. Of course, there were differences of opinion which may be reflected in later debates in this place. However, the fact that we felt it important to agree the report unanimously is a testament to the committee's dedication to getting this once-in-a-generation piece of legislation onto the statute books. Our work was supported by an excellent team of officials and clerks from both houses, and the committee are very grateful for their expertise and support in all of our work and in compiling the report. This mental health bill has, Mr. Deputy Speaker, been much anticipated. Detention rates under the Mental Health Act are rising, and there are a disproportionate number of people from black and ethnic minority communities being detained. Our attitude as a society towards mental health has also changed, and reform is needed. We welcome the principles contained within this draft bill. It introduces important reforms to improve patient choice, bring down detentions, and reduce racial inequality. In our inquiry, we heard concerns around implementation, resourcing and possible unintended consequences of the proposed legislation. Our recommendations address these concerns and are intended to make this important bill stronger and more workable. However, the process of mental health reform cannot stop or even pause with this bill. There needs to be further consideration of fusion legislation of the mental health and mental capacity laws. During our evidence, it became apparent that someone needs to drive mental health reform on behalf of patients, families and carers. We have recommended the creation of a mental health commissioner to oversee this process and to challenge the stigma that still exists around serious and enduring mental illness. Proper resourcing and implementation will be crucial for these changes to work. Mental health services are under enormous pressure and significant changes and improvements are needed to provide high-quality community alternatives to inpatient care, particularly ensuring there will be sufficient workforce to deliver the proposed changes. We welcome commitments from the government to increase spending on health and social care, but most people we spoke to, including mental health providers, were still unconvinced that current resourcing or workforce plans are adequate. The government must publish a detailed plan for resourcing and implementation of the introduction of the bill, including the implications for the workforce, and it should report annually to Parliament on its progress against this plan. The independent review structured their work around 4 key principles that should shape care and treatment under the Mental Health Act. These principles were choice and autonomy, least restriction, therapeutic benefit, and the person as an individual. These principles should be included on the face of the bill to ensure they endure and become a driver of cultural change. Tackling racial inequalities in the use of the Mental Health Act must be at the core of the reform. Black people are 4 times more likely to be detained under the Mental Health Act than white people and 11 times more likely to be given a community treatment order. These figures are rising. There has been a collective failure to address this issue, and we now feel the time has come for this to be addressed. Understanding of racial inequality must be included in the bill, There must be a responsible person in every health organisation to monitor data on inequalities and oversee policies for change. We heard evidence that community treatment orders are ineffective for most patients and disproportionately used for black patients. We have therefore recommended that they are abolished for civil patients and reviewed for use with forensic patients. On the important issue of the detention criteria, the draft bill makes changes to the grounds on which someone can be detained for assessment and treatment, with the intention of moving away from risk-based model and ensuring that detention will benefit the patient. Accountability is welcome, but we heard that it may lead to people being detained, being denied the help that they need when they most needed it, particularly patients with psychotic illnesses and those with chronic and enduring mental illness. We recommend some changes to the criteria and greater guidance in the Code of Practice to prevent this. Too many autistic people and people with learning disabilities are being detained in inappropriate mental health facilities and for too long. Change to the way that the Mental Health Act works for patients with learning disabilities and autism is also long overdue. The Government's intention to address this by removing learning disabilities and autism as conditions which can justify long-term detention under Section 3 of the Mental Health Act may lead to benefits in the longer term. However, we heard that without proper implementation, these changes could make the situation worse and potential displacement of people with learning disabilities into the criminal justice system could occur. There must be improvements in community care before people with learning disabilities and autistic people can be supported to live in the community. It's vital that reforms are not implemented until this is achieved. Another pressing risk is that these communities may be detained instead under different legal powers and possibly criminalised. This would be the opposite of what the change is intended to achieve. The Government must address this risk before the changes are implemented. We have therefore recommended the introduction of a tightly defined power to allow for longer detention periods in exceptional circumstances with strong safeguards in place to prevent this happening unnecessarily. On patient choice, patients should be able to make choices about their care and treatment. The draft bill makes welcome changes in this area but does not follow through on a white paper commitment to give patients statutory rights to request an advanced choice document. We heard almost unanimous evidence supporting advanced choice documents, making advanced choices, making our recommendation that advanced choices should be a statutory right. On children and young people, following the COVID-19 pandemic, the numbers of children and young people experiencing mental distress has risen dramatically. Children and young people continue to be placed in adult wards or in hospitals far from home due to the lack of appropriate care placements. This draft bill misses a crucial opportunity to address this. We also believe that children should benefit from stronger protections in the draft bill which support patient choice. This is a complex area and the Government needs to carefully think through its proposals, consulting further where necessary about this bill and how it will interact with the Children's Act. So in conclusion, Madam Deputy Speaker, it's 40 years since the 1983 Mental Health Act. This draft bill is needed. If the Government is willing to address our concerns in the ways we have suggested, it can make an important contribution to the modernisation of mental health legislation. Within our suggested amendments, we hope that the Government now acts swiftly to introduce the bill to Parliament in this session so it can then be further scrutinised and improved by Parliament.
Hello, Minister. Dr. Regina Allen-Carr.
Thank you, Madam Deputy Speaker.